Welcome all of you, and to let you know that she's in Hawaii, but she extends her aloha. And then she said to say, everybody sit up straight. If you know Patricia, you know that's exactly what she would say. And that she misses you and wishes that she was here. Ladies and gentlemen, I would like to present to you my friend, and a man who I consider a virtual rock star of nutrition, health, and longevity, Dr. John Westerdahl.
Thank you. Thank you, Michael Bowker. And welcome, everybody. It's nice to have you here tonight. And as Michael mentioned, Patricia extends her aloha from Hawaii. She's there right now. I wish I was there. No, I'm glad I'm here because I'm here with you. But anyway, today we're going to be talking about anti-aging nutrition secrets for health, beauty, and longevity. And the more we study nutrition, the more we see that nutrition plays a role in all these areas. Definitely we know about our health. A lot of people aren't aware of how it impacts your skin and your beauty. And definitely a lot of good research to show that it can add years to your life and life to your years by eating the right types of foods. First of all, the main thing I want to focus on is this, is that foods from plants prevent the diseases that are killing us. Fruits, vegetables, whole grains, beans, and all we have to do is eat more of them. And unfortunately, most Americans don't get enough of them. In fact, the average American has one garden vegetable every other day and one fruit every day. That's not enough. Foods from plants promote health, longevity, and beauty and vitality. The more you eat them, the better it contributes to your overall well-being, the more foods that you can. So we're going to focus in on these foods. These are the key things that we want to emphasize tonight. But you know, as we look at the healthcare crisis that we have today, a lot of people are wondering what's the future of healthcare. And you're hearing all the politicians these days running for president saying cheaper drugs and less costly health insurance and all these different things they're trying to promise. However, I think they're going in the wrong direction. They really need to look at people's lifestyle and approach that part of it, preventive medicine, lifestyle medicine, as opposed to just seeing how we can get drugs cheaper and how we can get surgeries cheaper and that type of thing, because it's bankrupting our country today. We are in a healthcare crisis today. Today, the Surgeon General has said that the way kids are eating, you know, the obesity problem with the children, that if we continue the way we're going right now, in this generation, parents will outlive their own children. Today we see children, 7-year-olds with adult onset diabetes. We see 13-year-old children with their arteries all plugged up because of the high fat and cholesterol type of diet that they're eating. Now, I used to work at this hospital in Hawaii, where Patricia is right now. I used to be the wellness director and the nutrition director of Castle Medical Center in Hawaii. And this is very typical of hospitals all over the world, all over the United States today, is that 70% of the patients here at Cottage Hospital or wherever you may be in America are there because of their diet and their lifestyle. So imagine that. If people ate right, they exercised right, they learned how to control their stress, they lived healthy lifestyles, chances are 70% of those patients would not be in those hospital beds. Now, several years ago, in the Journal of the American Medical Association, we had this very profound statement. It says, in the coming decades, the most important determinants of health and longevity will be the personal choices that are made by each individual. It's the choices that we make that determine our destiny when it comes to our health and our longevity in 90% of the cases. Yes, genetics can play a role, but believe it or not, it's 90% of people's health and longevity is their diet and their lifestyle. Genetics plays an important role, but a lot of people think, well, I have to have diabetes, or my mother has diabetes because of genetics. It's not that the genes are causing the diabetes. It means that they are more susceptible to getting diabetes or heart disease or cancer. However, if they ate right and they did the right things in their lifestyle, they can overcome those genetic dependent tendencies. And unfortunately, one of the things that people inherit is lifestyle habits. If you're growing up in a family that's eating a lot of bad food and junk foods all the time, chances are when you get older you're going to be doing that same type of lifestyle unless you make some big changes. Now Hippocrates, the father of medicine, said back in many years ago, "Let thy food be thy medicine, and thy medicine be thy food." Do you know before there was medicine, there was food? And that's the same with cultures all over the world, whether it's Chinese culture or it's the Greek culture in Hippocrates' case. These ancient cultures traditionally treated sick patients by changing their diet and their lifestyle first. So we want to get a plate. Now the USDA's come out with the plate diet, you know, where they show, instead of the pyramids no longer around, they have a plate. And the emphasis on that plate is to put a lot more vegetables on the plate. Now, the diseases in our country are really diseases of affluence. Now, unfortunately, in some other countries, they have diseases caused by, you know, sanitation problems or contagious diseases and so forth. But here in our country, it's diseases of affluence. And these are the diseases that are related to the rich American diet. Atherosclerosis, heart disease, stroke, obesity, arthritis. You can go down the list, colitis, constipation, different forms of types of cancer. There is a direct relationship to the rich American diet and lifestyle and these diseases that are so prevalent in our country today. In fact, the American diet, I call it SAD, S-A-D, Standard American Diet. And the Standard American Diet promotes lifestyle-related diseases and premature aging. We are killing ourselves with our own knives, spoons, and forks. We're digging our graves in many ways. So here again, foods from plants prevent the diseases that are killing us. Vegetables, fruits, whole grains, and beans, eat more of those. Now, saturated fat is definitely linked to heart disease. And the more saturated fat we eat, that can raise our blood cholesterol. And by increasing our blood cholesterol, that increases our risk of strokes as well as heart disease. So saturated fats are primarily in what types of foods? They're primarily in animal forms of foods, whether it's chicken. By the way, some people don't realize chicken has the same amount of cholesterol as red meat. The saturated fat's is lower, but the same amount of cholesterol. Or these butter or cheese. You know, it used to be red meat was the single highest food that people eat that contributes to atherosclerosis or hardening of the arteries. Now people are cutting back on red meat, and we're finding that cheese is the big culprit in the American diet that's raising cholesterol and plugging up the arteries. Now here we talked about foods from plants prevent the diseases that are killing us. There is no cholesterol in any plants. No, fruits have zero, nuts zero, grains zero, vegetables zero. Sometimes people say, well, yeah, but what about avocados? I heard they're high in cholesterol. They're not high in cholesterol. They are high in fat, but it is a healthier type of fat. It's what we call the monounsaturated fats. Here we have a cross-section of an artery, and you can see in the center there, you can see the buildup of cholesterol plaque along the arteries. Here's an actual photo of some of the plaque buildup on these arteries. It narrows the arteries, what you need to get your circulation, the blood flow. And here's one that's 99% plugged up, built up with cholesterol plaque. Very serious problems. But 90% of this is caused by diet and lifestyle. The good news is, however, scientific research has shown that we can actually reverse heart disease. And a good friend of mine, Dr. Dean Ornish, how many of you have heard of Dr. Ornish? He is a pioneer in the area of heart disease reversal, and a number of years ago he published the major study that appeared in the most prestigious medical journals in the world, and that showed that you can reverse heart disease through a very low-fat vegetarian diet and lifestyle. And of course he incorporated some exercise with that and some stress management also in combination with that. But he found that patients' arteries actually, after 1 year on this low-fat vegetarian diet, 82 to 83% of those patients had reversal, obvious reversal. Some of that plaque actually was reduced along the walls of the arteries after 1 year. He checked again after 5 years, and they found out further reversal was possible. Now, he also did an interesting experiment where he put some of the patients on the American Heart Association diet. That's the diet that most doctors tell you to follow if you have heart disease. You know what he found out? Those patients didn't improve, or they even got worse. And that's what doctors have been recommending for years for people to control their heart disease issues. However, what this research shows is that in order to have big results in heart disease, and actually to have reversal of heart disease, you have to go on this low-fat vegetarian diet is the optimal diet for reversal of the disease. Now this is an example, and I wish I had a pointer here, but I'll just have to come over here. Here's a patient on the left that started, they had bad atherosclerosis, and then after 1 year on the right side there, you'll see that there's much more color, particularly red and yellow in there. Now what that shows is increased circulation in the blood vessels. So this was one of what they call a PET scan. This is one of the things that they use for testing to prove that there was reversal of the atherosclerosis and the arteries were opening up, getting more circulation through the heart. Couch potato syndrome, what we call pre-diabetes nowadays, metabolic syndrome, or also it's known as syndrome X. This is when you're really at high risk of heart disease and diabetes, is that when you have high levels of abdominal fat combined with high blood triglyceride levels. Triglycerides is a fancy word for blood fats. When you have low blood levels of the good type of cholesterol, the HDL cholesterol, when you have insulin resistance and high blood pressure, when you have a combination of all these, you are at pre-diabetes. In fact, you could be even diabetic. Here's different causes of cancer in the United States. You notice that 30% is related to tobacco, 35% is related to diet, and then there's 18% undetermined. But you can see 65% of the cancer risk is associated with smoking and diet is actually at a higher risk factor than even tobacco. So just by not smoking and eating a healthy diet, you can reduce your risk of cancer, developing different types of cancers, by 65%. Poor diet and the use of tobacco, here again, may cause as much as 65% of all cancers. Now, here's some things about cancer prevention guidelines, and the number one guideline that all of the scientists are saying is to choose most of the foods that you eat from plant sources. And in Hawaii, where I lived for a number of years, we had a program to teach people about eating more plant foods, and we call it Eat a Rainbow. The thing is, eat all the colors of the rainbow. And what's the colors of the rainbow? You can remember Roy G. Biv: red, orange, yellow, green, blue, indigo, and violet. So try to get a variety of foods, and the more colorful the fruits and vegetables, the better they are for you, because they have wonderful antioxidants and phytochemicals that fight against heart disease, that fight against cancer and other diseases, that actually help fight against Alzheimer's disease even. Vegetables play such an important role in cancer, in the treatment of cancer and the prevention of cancer. You see at the top there a normal cell. That's a normal, healthy cell. However, and when you eat lots of fruits and vegetables, that blocks that cell from going to pre-cancer. By eating more fruits and vegetables, it prevents precancerous cells to go into cancer cells, and the more vegetables saturating the body with the fruits and vegetables, that even prevents cancer from going to invasive types of cancer. So every step of the way in the whole development of cancer, the more fruits and vegetables you eat, the more powerful things are to help prevent that from progressing. Let's talk about anti-aging. That's what we're here about today. How many want to learn how to be younger and healthier?